All right, and Marky.
My name is Dr. Ruth Waterman. I am a medical doctor and I also have a master's in science. I'm an anesthesiologist. I'm the chair of the Department of Anesthesiology at UC San Diego, and I'm also the director of anesthesia for perioperative services. In a nutshell, I put patients to sleep every day while I'm doing surgeries, keep them safe, monitor them hemodynamically, ensure that they have good care during their surgeries. I also do OB anesthesiology, so put epidurals in, participate in C-sections, and I am a liver transplant subspecialist, so I do a lot of anesthesia for liver transplants. And then perioperatively, I make sure that the operating rooms are running efficiently, I hope. We have the Department of Anesthesia, which is a research division and a clinical division. So in our clinical division, we have about 90 physicians, and then we have approximately 12 people who are in the research department. So I oversee about 102 physicians and PhD. We have nurse anesthetists. We work in a care team model, so there's another 60 of those, and we have 46 residents and probably about 20 fellows. So it's a very large group of people. Yeah, I've been doing this for a long time, and it seems that things are probably, at the worst that I've seen them during my professional career. I have a lot of people who just seem disengaged, burned out, not connected at all with their patients, with each other, and they just feel like they don't want to even be at work. So there's a lot of quiet quitting now, people not wanting to volunteer, not wanting to help out, and not wanting to go the extra mile. I think that we feel disengaged from our patients at a greater level, secondary to many issues. One, I don't feel like we always can give our patients the best care that we can every day. Two, there's a lot of additional things besides caring for patients that we have to do, like electronic medical records. Three, I don't think that we always feel supported by our culture as a whole for taking care of patients. I feel that once we get to this point, society loses out. We really want to have equity in healthcare, and we will never achieve that if we have all of these issues that are arising in people not wanting to come to work, not wanting to show up. It may be that when I'm a 90-year-old woman, there is no one to take care of me because people don't want to go into healthcare professions. We don't have enough nurses, we don't have enough doctors, we don't have enough, people even to clean our hospitals at this point. So it is something that's just dragging on our society as a whole. Obviously, we need a health system, but we need one that also works for everyone and is fair and equitable for everyone. So I think that definitely people are feeling like they are not getting what they need out of the health system because a lot of people are disconnected, or we just don't have people to care for them. And when you do that, it then makes all the providers who are trying to do their best focus on the negative instead of us being able to focus on the positive. We also have a lot of things that we do in healthcare that are generated by the fact that, we have to have an efficient medical center that doesn't always allow us to connect with our patients and to give them the time that they need. And we have, appointments that need to be, attended to in a specific amount of time. We have surgery that has to get into the OR by a specific time. And all of that just adds to the burden of trying to take care of your patients. You have to remember that patients are not like a widget. We don't treat our patients like they're a Starbucks latte, and then if you get a grande size, this is what we're going to do with that patient. I can do a cholecystectomy, and my anesthetic may change for every single patient that I do that for based on their comorbidities, etc. And so we really need to get back to having connections with our patients, and I feel that if we were to do that, we would change a lot with healthcare. The problem is it's, overrun, overburdened, and it makes it hard to do that. You go into healthcare thinking that you're going to help people and that it's a noble cause, and a lot of us also maybe have a little bit of a martyr complex, and we feel like, we have to, sacrifice a bit. And I think that's where you truly go into it, is because you have that personality. Or there are some people who just love all of the studying that you do in terms of learning about the body and understanding that and having a challenging career. But I really think people go into it because they want to help other people. They want to connect and know that at the end of the day, they did something that helped a patient or helped society. And I think some of us aren't feeling like we're always helping our patients at the end of the day. And I think that's really what contributes to burnout sometimes. I think the main thing with burnout is that you're just feeling like you don't want to be in the hospital or anywhere associated with it. You don't feel like what you're doing has any value and it's not making a difference anymore. And so if you couch that with the fact that so many people go into medicine thinking they're going to help people, and at the end of the day you don't feel like you've helped anyone, it really can be demoralizing to you. And so I really have empathy for people who are at that point where what they thought their intended job was going to be is nothing like that today. Well, Hummel is the vice chair of research for our department, so he's always coming up with ideas or running things past me. So one day he says, "Hey, I got to talk to you about something." So, "Sure, Hummel, well, whatever you need." And he tells me that there's this guy, calls him this guy who, well, I wouldn't bring it to you, Ruth, but I think he has something. I said, okay. So he sits down and we talk, and he says, "You got to read his work." And I said, "All right, why?" And he says, "Well, because I can't explain everything." He says, "And this is something that's bringing me to wanting to look at this guy and wanting to be involved." And I said, "Okay, well, cut to the chase. What's going on? What is this guy doing?" He says, "He meditates." And I said, "Meditates?" He says, "He meditates and he's helping people." And I said, okay. And he says, "And you'd never believe, I wouldn't believe it until I went," he says, "and I saw it for myself." I said, "Well, that's interesting." I said, Hummel, growing up, I really, was taught to believe that there's a lot of power in the mind and having positive thoughts and all that. I said, "So, if you're going to do this, like, how are we going to do it right? Like, what are you going to do? How are you going to make sure that people understand and really want to look at what's going on?" And at that point, by then I knew this guy's name was Joe. Okay, so what is Joe doing? And Hummel said, "I think I can convince him to let me have biological samples." And I said, "What?" And he's like, "Yeah, I mean, all samples." And I know, the microbiome's a big thing. People don't mind their feces being tested at this point in our country. Like, you test it, it's fine. And he's like, "I think I can get them to give me blood. I think I can get them to give me cheek scrapes. I think I can get them to, give me a stool sample." I'm like, "Okay." And he says, "And then we can see what the meditation does. We can check before and we can see what it does and what happens after." And I was like, I love it. I love it because we may be able to find the biomechanical background to what's going on with the people here after they're doing this meditation. So finally, once Hummel had the ability to arrange for Joe to come in town, I was able to meet with Joe. I read a couple of his books before he came by, and Hummel convinced me. And I also saw a personal change in Hummel that it was very real and very tangible. He just seemed like he was a changed man and so much more positive and looked so much more happy and content with life. It was astounding. He became just less negative, more positive. He smiled more. He looked healthier. He was a changed man. I mean, this is why it's so important that Hummel's collecting samples, right? Because they can give us tangible evidence as to what's going on inside the body. And from what I know of breathing, from what I know of what's going on and what Hummel has conveyed to me, the way that we breathe affects our sympathetic nervous system. Our sympathetic nervous system is the system that makes us want to fight, that makes us want to run, that makes us want to, handle anything that's stressful for the day. But it can also, when elevated, increase a lot of our inflammatory markers. And when we have a lot of our inflammatory markers elevated, they can mess up the blood-brain barrier and actually can cause inflammation around the brain, which has a direct effect on our ability to do a lot of things. So we know that there's people who have depression and their inflammatory markers are way up. We know that people who have, GI disturbances, they have issues with their inflammatory markers, but we also know that breathing can help control that. So I really feel that that's part of the circle of what's going on and contributing. So when Hemel brings back his samples and he's been able to see that, the blood samples, some of the stool samples and everything are indicating that there's less inflammation, I think that that's probably one of the mechanisms that's contributing to all of these things that he's seen when he goes to Joe's events. So when people take a breath in, they're breathing in air, which is 21% oxygen. The oxygen then goes into the lungs, down into the alveoli, which are like little tiny sacs in your lungs that then allow for exchange for your CO2, and CO2 is a byproduct of metabolism that goes on inside your body, and that, when you exhale, exits your body. It helps keep your blood pH in balance so that you don't become too acidic or too alkalotic, and it creates harmony within your blood system. So if someone is breathing too rapidly, if they're not breathing fast enough, you can have changes in your CO2 that go into your system. CO2 has an effect on the pressure in your brain. So when your brain is swelling, for example, if you have injury to your brain, if you have any type of assault on your brain, we try to bring your CO2 down, because lower CO2 then decreases the pressure in your brain based on chemoreceptors that are in your vessels. So there's a lot that breathing does biochemically through your system, which is why it's so important we figure out how the meditation is working and what's going on when we're taking a deep breath versus short, shallow breaths, or when we're decreasing the rate at which we breathe in. Yeah, I don't think we fully understand all of that at this point, which is why it's so imperative we figure out what exactly is going on. Some people are able to meditate, and when they describe this different level or different state that they're in, they basically say that they have lost all touch with the world, that they're on a different plane. And I don't know exactly what's going on, which is why, Emil and I have discussed, should we be doing EEGs? So should we see what's exactly going on in the brainwave patterns? Are they like when someone's under anesthetic, for example, and we know that the brain isn't making any connections during that time, so there's no memory of the surgery. And, are you unconscious? Is it a different state? All of this needs to be investigated, because there is no true indication of everything that's going on at that point. I think it's in a kind of, well, when I say amnestic state, amnestic, it means like three things. It means you don't perceive, you don't feel pain, and you don't remember. But I think people remember, according to Hemel, some of the stuff that happens, but they are just on a different plane. It's very interesting what's happening. So it'd be cool to see the EEGs and just the patterns and what's going on where and all the different lobes. Like, does it more affect your area, your frontal lobe and your reasoning skills and whatever, or I don't know. We can see, so there's one thing to describe what's going on, right? Like, for example, oh, well, maybe the EEG pattern changes the type of wave pattern from, to a beta wave, for example. But, what is that doing then, right? So it's a description of that, but what does that mean? And that's really what's missing here. And if we're going to get, physicians, nurse practitioners, PAs, nurses, everyone to say, hey, this has a lot of value in the healthcare system, we've got to have evidence-based medicine, which is what we are taught to use to make our choices. And I think that that's going to be really important. So this is why I so back this type of research, because you can see the effects of it. But how do we get from we're doing something like meditation to an end result of someone, feeling as if, they're no longer depressed, or someone whose back no longer hurts them? What is the mechanism between there? And until we have that laid out, people are going to be skeptics, and they're going to say, oh, they're a charlatan or something like that. We use Western medicine, and it does a bunch of things for us. We can cut out a bad gallbladder, we can fix a broken bone, we can give someone a massive blood transfusion while they're bleeding out after an automobile accident. But there are other things that just don't always seem to fit, and we're not totally able to heal a person. And I really think that something's missing, and one of it may be the fact that we don't have, for lack of better terms, because I don't know yet where everything will go, we don't have the proper mindset at this point. So what we could think about doing in the future is teaching patients really how to gain control of their meditative state or breathing pattern if they can't even reach a higher level of meditation, and help them control what's going on. But we need to have the evidence behind it. We practice evidence-based medicine, and that means that in order to see how we get from using something and its effects, we have to know the steps. And that's what Hemmel is aiming to do with all of his research. And it's super exciting because there are results there. They're very, very evident. So I'm very excited about the uncharted territory of the mind, because we still do not know much of what our brain does. And it's hard to research it because you can't take it out and then put it back in, and it's hard to see, and we just don't know. And even if you look at a brain, it just looks like nothing. It's like amazing that it actually can do what it does. So I just think that this work is going to be transformational. I think it's a new paradigm of healthcare. I think that the timing is just correct right now. We have a burned out group of healthcare providers, a burned out world. We have patients who want more answers. And we also have a younger generation that's more open to things that are not just what their parents were doing or what the boomers were doing. They want something new. They want to see results. So it's very urgent.